Hi, and welcome to another video presentation on cognitive assessment. These next 4 presentations will all focus on the topic of objectivity. Today I'll be talking about my own evolution as a neuropsychologist. I was trained as a postdoctoral fellow in the Halstead-Rayton system. Within that system, there's a fixed set of tests that are administered, and they are administered by trained technicians. The clinicians dictate their reports from the test data sheets without ever seeing the patient perform the tests or even meeting the patient. The test scores were all we had. When I started my own neuropsychology laboratory at Stanford in 1973, I decided to do it a different way. I wanted to see my patients as they performed the test so that I could observe them in action and have a better understanding of their difficulties. I felt that distance did not make the clinician more objective, but actually cut the clinician out of a whole range of phenomenon that could be observed, explored, and investigated. Scientific study depends on close observation. I also realized that scores alone did not provide meaning. The meaning that one gets from a set of poor test scores is always inferential. The scores do signal that something has happened, and they're often the starting point of an important investigation. I became an investigative clinician, someone who wanted to look closely at the phenomenon being studied and the patients who were having difficulty. Patients react to the testing process and become discouraged, confused, just have difficulty, and we need to figure out what's going on. It is imperative to engage our patients at various times during the testing process. This may be subjective to some degree, but it allows us to obtain a set of objective observations that we would not have otherwise. And it does not prevent us from giving the tests in an objective fashion and using the scores in their traditional way. Over the last 15 to 20 years, neuropsychology has become caught up in a demand for increased objectivity. I believe this is a problem, and I'll talk about this more next time. I hope you will join me then. Thank you.